Perfect. I'm going to bring up the screen.
Well, good morning, everyone. Welcome to the April 5th, 2023 meeting of the Health and Wellness Advisory Committee for the City of Charleston. This is the first day of Passover, which begins at sundown tonight. So I want to wish our Jewish friends a happy Passover, Holy Wednesday for our Christian friends. And I know many of us are looking forward to Easter, on Sunday. It was a busy weekend this past weekend. I'd like to thank Paul Wieters and all of our city employees, as well as all the volunteers who put so much work into the Cooper River Bridge Run, making it a world-class event again this year. I participated and I heard from several people on how great of an event it was. Of course, we've got the Credit One Charleston tennis tournament happening this week, which is another incredible event in our city facilities that I hope you'll take advantage of this week. And it's National Public Health Week, and Paul forwarded some information from Dr. Katie Richardson about some presentations you may want to join this week, and she'll probably speak more about that later in the meeting. Paul also emailed us some news and announcements from the Office of the Assistant Secretary for Health, including some actions the Biden administration has taken to make Narcan more accessible, as well as information on National Minority Health Month, National Youth HIV and AIDS Awareness Day, National Environmental Education Week, National Infant Immunization Week, and World Health Day and Earth Day. So if you haven't seen that email, you take a look. It's a lot of information that Paul sent to us, and we appreciate that. I am going to make a motion that we approve the minutes from March 1st, 2023. Paul sent those out earlier. Can I get a second on that, please?
Second.
Thank you. All in favor, please say aye.
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 Any opposed? So the meeting of March 1st minutes have been approved. So now next on our agenda, I'm going to call on item number 3, the Tri-County Community Health Needs Assessment 2022. We have our Director of Diversity, Inclusion, and Health Equity from Roper St. Francis Healthcare and former Director of Health at Trident United Way in Charleston, Renee Linyard-Gary. So I'm going to turn it over to you, please. Thank you.
Thank you, Kevin. I appreciate that warm introduction. Hello to many of you who I know from the work in the community. I'm glad to be here today, and thank you for giving me the platform to share about the work that we've been doing with our community health needs assessment and the community engagement on that data collection tool that we all can use going forward as we work to strategize and develop programming around our community's health and well-being. With that, I'm going to share my screen here with you all. Thumbs up from everyone. You can see my PowerPoint slide. I like to keep it this way because when I go into slide mode, I lose some capacities that I like to keep control of during the presentation. But as you all heard in the introduction, we have recently completed our Tri-County Health Landscape, which is our 2022 Community Health Needs Assessment. It is a data collection that we take from the community, from our communities, both in Berkeley, Charleston, and Dorchester counties. And a good bit of today's time will be spent to make sure that we give you an introduction, an overview of Healthy Tri-County, programming that has been in our community under our collective impact strategy here in the region. It has done monumental milestone building, is what I like to say, over the last 5 years that we've been in this health improvement plan work. And then also just give you that overall review of the health landscape and report, and then open it up for any questions that you might have or any feedback. So just high level, just reminder of Healthy Tri-County and the work that has been going on since I believe when we started our work around the 2016 Community Health Needs Assessment. But Healthy Tri-County is our multi-sector regional initiative to improve the health outcomes in Berkeley, Charleston, and Dorchester County. And it was launched by Roper St. Francis, MUSC Health, and Trident United Way in January of 2017. The long-term goal of Healthy Tri-County is to improve the health and well-being of every person and community within this Tri-County region. And it is through the collective impact framework that we move the strategies and actions and recommendations that align in our health improvement plan work to create that meaningful community change. And what that means is that we have a shared agenda with a shared goal, which requires us to have constant, continuous communication, mutually reinforcing activities along the way, and those shared priorities to get to collective impact. And many times that takes a backbone organization and structure. And for our region, Try to United Way has been that backbone organization in partnership with the two healthcare systems that you see listed here. And what we have learned in this time that we were in dual pandemics is that it is a collective. It takes us all. As we were going through uncertain and unprecedented times, we all have taken roles where each of these entities had to step up in different capacities. But the other thing that I will tout about Healthy Tri-County is that from my last count before transitioning, we're up to over 90 organizations throughout the Tri-County area that were partners and pledged to help move this health work forward, as well as over near 1,200 individuals in that last count. And so that's something to pat our backs on as a Tri-County region. And just to give you that framing of how we continue to move this work through our health improvement plan work groups and committees and councils, which you see here to your far left is our health data work group, which you can see is the activities that align. And so one of the major activities is exactly what I'm here to talk about today is our 2022 Tri-County Health Needs Assessment. That group also helped move the work in 2016 and 2019, and that has been a promising practice under Healthy Tri-County, keeping this work group together. And then we also added having a health data resource hub. So not only do we provide the data collection information and what the top priorities are, but also aligning resources to those top priorities identified every 3 years through our community health needs assessment process. We also have our health improvement plan work group, which is responsible for the implementation and monitoring of a 5-year plan that we came together to develop with the community, with multiple stakeholders from different sectors at the table to develop what are our top priorities, what are the recommendations, what are our indicators of success, and how we were going to get there is really what that health improvement plan work group is about. One of our very first coalitions or councils out of Healthy Tri-County was the Diabetes Coalition that you see here third on the list. And that initiative and a group activities are to raise awareness about reducing the rates of prediabetes and diabetes, but also increasing the availability of the National Diabetes Prevention Program. And actually at this point, we were able to grow this program and even give a warm handoff to a lead organization, Access Health, which is under the umbrella at Roper St. Francis, but also a community-wide navigation program that we were able to sustain that National Diabetes Prevention Program enhancement and expansion across the region by finding that hub and lead organization to lead that work effort. And last, but certainly not least, Healthy People, Healthy Carolinas. I think you all are familiar with Joey Current, who is the health program manager and a part of this wellness committee, who leads the charge of this grant initiative. And their activities are to implement evidence-based interventions addressing physical activity, nutrition, and early detection of prevention of chronic diseases. But all of this work is lifted and through the lens of social determinants and health equity. And we are able to identify and shine the light and spotlight those health inequities and health disparities that we see in our region through platforms like our conversation on race and health equity, and also just by sharing out and dissemination of those equity resources. We recently had a March conversation on health race and health equity that was led by our partner at the Medical University and team, where we featured recent health equity updates from our South Carolina Department of Health and Environmental Control. And that was a well-attended session and really just shows the beauty of having this network where we can have collaboration, consultation, and really communicate what the other is doing, but also be able to give the update around data and where our needs are most emergent. I'll pause there just to make sure there was nothing else that we wanted to add, Paul, to the discussion or anything that you wanted to highlight from this overarching umbrella framework.
No, I think the foundation over the years has just been strengthened by your leadership and Joey coming on board. So we're excited with where we are right now, at least of knowing better information. So.
Okay. Thank you. And as Paul shared, a lot of this work is for all of us. While we have great leaders that many of you on the call today in our community, we really want to make sure that we're aligning with our community partners and members and stakeholders. And so we are right in the middle of completing our 5-year plan around this community health improvement. We also had a community action guide to guide the community over the past 5 years as we close out this marked time to focus around the same common strategies and get to the same goals. We will be also reaching out to the community to get more feedback about some of the work that has been happening through our work groups, but also individually and collectively so that we can wrap this up and package it into a final report out of the 5 years of work that we have put into our Health, Our Future and the Tri-County Health Improvement Plan work and work groups. So something to look forward to. But the main purpose for today, something to celebrate, is that we collectively have come together, and this is actually our 3rd community health needs assessment that we've done with our community partners and core partners of Healthy Tri-County. As you can see here, it is a collaborative effort amongst the 3 organizations listed here. And just to show the process that it takes to move this work, it is around data assessment and getting community input, prioritizing and implementation of those information that we receive back from the community. There's ongoing monitoring. And as I just shared, there's a component of reporting. And then we get to start the process again. So it's a continuous process. It's an ongoing cycle to stay timely, and make sure we have the most up-to-date information. And then looking over the methodology behind the health needs assessment, it's administered, as I stated before, by our health data work group. This time around, what was different though in 2016 and 2019 was that the health data work group created and administered the health health assessment tool. But this time around, we were invited because of our regional effort to join in on the statewide community health needs assessment pilot project and to be key informants to their process and the development of their survey tool. And we were able to now instantaneously, by using QR code and online forms and paper forms, we're able to give impact to their data collection at the state level. So now our regional efforts are being counted in the statewide community health needs assessment. In previous years, we were, operating on our regional level and then would give that information over. But while the state is collecting for their pilot project, this information being presented today is also being shared at the state level and can be counted in their assessment and in their evaluation of what the emerging health needs are coming out of Charleston, Dorchester, and Berkeley County, along with the other counties here in South Carolina. So that was something that I think was something to be proud of and to be invited to be a part of that discussion, and a great team of researchers and public health practitioners. And as I shared before, it was available online and through paper and English and Spanish. We had this time around over close to near 1,000 participants 678 surveys were collected. We had input participant sessions where we had community-wide virtual input time where we were able to do polling and surveying during many of our network activity through our partnership with Trident United Way, through the Healthy Tri-County Health Improvement Work Group, but also through our Safety Net Assistance Network. We were able to have the input from the community real-time virtually. With over 47 focus group participants, 10 interviews with key stakeholders from the community, and in those focus groups, there were 9 of them, and overall there were 47 participants. What we were really trying to focus on, because we had such a robust 2019 health assessment, was getting more into the qualitative feedback. What we wanted to check for was that we knew the 5 priorities that we had identified really since 2013, since Roper St. Francis. It was a requirement for our nonprofit status that we conduct a community health needs assessment. And we came together collectively in 2016 with the core partners that I mentioned before, MUSC and Trident United Way. But in this collective effort, we really wanted to make sure that we were still aligned with the same 5, top priorities, but also just hear a little bit more from the community on that qualitative front. We were able to do that with help and support from our public health school at the College of Charleston, and utilizing their students in the public health program by providing them training to do that level of research with the focus groups. And with 3 students, a total of 4 overall for this project, they were able to conduct the focus groups and also get some learning and education along the way about how to conduct those qualitative research sessions. And so I owe that to Dr. Morgan Huey and her leadership there over at the College in Charleston, and also her participation and leadership on the Health Data Work Group. To make that connection and be able for us to utilize a great resource within academia and with our academic partner at the College of Charleston. So what we see out of the survey data is the representation here by county. So 55% of responses came through from Charleston County, 25% from Berkeley, and 18% from Dorchester. And that ongoing data collection, I believe this at the statewide level, they may have just closed it out at the end of March, the data collection. And so that was an ongoing, while we had our stamp in time where we collected data at the beginning of 2022, that data collection has been able to continue through this statewide collective. So just wanted to call that out, that it's an ongoing process. And so down to the data, what we found was here you can see the ranking, access to care. There was no change there. It's still number 1, one of the key leading top ranking priorities identified by the community through that data assessment. Clinical preventive services, and so that moved up. And if you were to probably think about the timing of the survey, we were coming right out of COVID, where I think people knew more about immunizations and vaccinations. That's what clinical preventive services are. It's about our cancer screenings and things like our diabetes prevention work. And so that priority moved up the ranking here in 2022. What you see here in its grade here is oral health, and that moved up. But when we developed our health improvement plan work, we grouped oral health with access to care, because oral health many times is the first part of our having quality health care. What we consume and able to partake in really helps us with our overall clinical care, medical care that we get. So we group that in our access to care strategies. 4th in the ranking there was mental and behavioral health. That has been a leading priority year over year. And, I see that this work continues to grow, and mental health and behavioral health being top priorities for all. Obesity, nutrition, and physical activity is next up in the ranking. And that is really around the work that we have aligned under our Healthy People, Healthy Carolinas work that Joey current leads. That's where we are able to get targeted focus on how do we build strategy around getting to improvement around that topical area. Sexual health, we have grouped that in years past also in that maternal, infant, and child health space. So when we look at the ranking, it aligns with how the priorities have ranked year over year, and we identify strategies and recommendations under that next grouping, maternal, infant, and child health. And so that really is all with the undertone of health equity. In each of these priority areas, we focus on health equity. How do we bring everyone to that quality care, no matter where they are along their journey to health? And so I just wanted to call that out. Health equity is always the focus of this collaborative, and really how we set the groundwork on developing programs and practices and policies. Next, I will highlight when I talked about, when we surveyed individuals in the community, we also asked for them to call out if they were providers or practitioners in the healthcare space and public health. And so within that ranking, we had over near 270 individuals who identified that they were providers or health practitioners. And when we asked them to rate by the population and the patients that they serve or clients that they serve, the health topic rankings that they identified to be the top rankings, mental health was number one, followed by access to care, obesity, nutrition, and physical activity, clinical preventive service. And you can see the ranking there. But what I will say is that the emergence of the awareness of mental health and how it impacts overall health as well is being called out by providers. I will also share that during this time, we had many of those key informant focus group sessions with leaders from the community. And when we had the qualitative feedback time, we asked what was the top priority that they saw right now in our community. And this is why we were collecting this data. And mental health and access to care were the two top priorities mentioned each time we had these focus group sessions. Also like to just highlight that overall data and demographic by income and the responses that we got in the categories there. You can see where most of our respondents by income, that 30 to 20% were, from the making $25,000 a year to $49,000 a year. That's about 20% of the respondents. About 30% of those individuals also surveyed made anywhere from that 50K and up. As you can see, by race and ethnicity, pretty representative of what we see in our overall population. So getting that feedback there, but I feel what we know is that we have an opportunity to dive in even more with our Hispanic and Latinx community to get more data from that group as well. So we also see that we still have opportunity to get more information and more targeted outreach to certain populations by this data collection. And then by education. So in our sampling, as you can see here, we have those with bachelor's, master's level, associate's degree, and their rankings. There's opportunity there too to get more from the those with high school, some college and associate degree levels to get a more equal balancing of the feedback. So while we always try our efforts to do targeted outreach and get the demographic that aligns with our population, there are times where there are just barriers to that and challenges. And so that allows us to think about how do we, in this next 3-year cycle, do even more focus group times and get more data from particular targeted groups that we may not have been able to get in our initial quantitative data collection. I believe this was provided to everyone before the session today, but just wanted to call that back out. Paul had requested that we provide the city of Charleston through the zip code level data that we can pull through that data set that was collected, and the responses that we got. And so here you can see average age, average household size, the veteran population, and these are the counts that we got out of the 200 responses that were over 200 with the city of Charleston responses. But in that ranking, access to care was number one, clinical preventive services, oral health, mental health. So really in the city of Charleston and those zip codes, we align with the priorities that you saw amongst the Tri-County, so that we know that if we work to provide initiatives or programming at the city level, right, or at the county level in Charleston County as well, it would align with our Tri-County work efforts and make impact and get us to move the needle a little bit more further along the way from where we started back in 2016 when we started this health collective. And then just highlighting our outreach efforts, we had just wanted you to see the way that we did our outreach. It was through a QR code. We disseminated at our hospitals in community forums where we as the Healthy Tri-County Core Partners were able to share with our leadership and our departments, but also at the community level through many of our network partnerships that we have. Sometimes there was tabling at our libraries with some of the work efforts that we had to collect the data. And then we had recently here where, we tried to take it on the road. And so the first time of taking it on the road show was through our conversation on race and health equity on March 20th. We have, for example, at our community events, we at Black Expo, lectures and presentations, and able just to utilize this information for current initiatives and as we all come together to develop plans along the way. And just want to give a highlight from that session that we had on March 20th. We had over 216 people register with 139 attendees. And what we find is that for this kind of conversation around health equity and getting this data and information, while you have 216 people registered, they register because they know they're going to get that information and recording afterward. And so while conflicting schedules then always allow us to have 100% participation, we still get a good number of people who can attend. And so we had near 140 people attend that session. And just wanted you all to see the breakdown that was provided to us around the number of people from each county that attended and the sectors that were represented during this time. And as you recall from my opening, this is a multi-sector initiative. So it's nice to always see that we still have a good representation of each of the sectors to attend events. And so our community health needs assessment opportunities that I stated before, there's opportunity to continue to have some student-led projects where we can get even more data and focus groups, particularly as priorities emerge or things change, and we want to query our community. We now have that connection, and because the health needs assessment process is every 3-year process, we also like to have those times to just check in annually or semi-annually to make sure the health priorities that we collected in 2022 still align in the years up until the next health needs assessment. And so right now we're in that phase of roadshow and data sharing like I'm doing today. And so that is an option for all of you as well, for a member from the Healthy Tri-County Core Partners to come and provide these presentations. And another opportunity that we'll have here for even more data collection, as I shared, we are in that rounding up our 5-year of our health improvement plan work and developing a final report to report back to the community about the impact that we've made. Have we moved the needle? Do we still have greater opportunities in some areas than others? And that data collection will be starting in May of 2023. And be ongoing so that by the time we get to June 30, we'll be having a report out for the fall time of this year. And we need our Healthy Tri-County community partners and their input. So we will be calling on you all who are moving the work in our community to let us know, what have you done in this time over the last 5 years? to help make impact. We also have a published report that we we took the opportunity to kind of get the halfway point of the data collection and efforts. So that's also a published resource for you all attending the session today to look back at some of the progress that had been made since we came together for this collective. And with that, I'll open it up for any questions or feedback. I haven't seen the chat because I had my screen up, but if there's any questions, Paul, that you can see in the chat or Q&A.
I don't, but I have a few questions to maybe start it all off with. One, you're still trying to get additional information from the community, I think, to help out. How can we help with posting anything on the city's website or pages to or opportunities to help y'all get that information out?
Yeah, so for our stamp and time and for the reporting, that is done, Paul. I know at the statewide, they were still collecting. Much of the QR codes were, the QR code is on the Healthy Tri-County website as well to help with that data collection and should still be open. So the promotion of that data collection, while they will denote their times, it's an ongoing process at the state level. And that's what we heard from them on March 20th. When they were a part of the conversation on race and health equity. So we can, help the greater statewide effort. And then I think there'll be times where we call on this partnership that we have here with the city to say, we want to come to your community. We want to hear from, your stakeholders. It might be around specific topics, like as we develop this next implementation plan, we might need to dig a little bit deeper. And so I know with, Joey Current being a part of this work and leading the charge over at Try to United Way right now, we will be able to come back and ask for that opportunity and have those targeted outreach times.
One more question before Kevin takes over with it, but the federal healthcare, I know that Try to United Way, I know that Roper St. Francis, and I know that MUSC, both the hospitals use it in their planning. How does FEDER get engaged in that, or are they engaged in that process?
With the use of the data, it's available to them. We have been in conversation through Try to United Way with that organization as well. I know from where I'm seated, it's constant communication with the leadership there so that we can be involved in the work. In years past, we've had strategic partnerships with FEDER. We continue to do that as well as we strategize. But it's more opportunity for us to even have more focus groups. I think, Paul, the one thing to note is that when this data collection was happening, many of our organizations were in times of transition, where leadership was transitioning, teammates were transitioning. And so the cadence that we had in previous years and iterations, things shifted. And that's the reality behind it. But we are still in constant communication. And it's available to them as a resource as well. But we know that if we have now the time where we want to do more intense focus groups, they are a partner. And it's one that I know from my end at Roper St. Francis that we stay in constant communication with the leaders there.
And then I had asked Kevin, I wanted you to tell Kevin a little bit about what you did before you started Try to United Way with access to care. How that started in our community and what that all did to connect everything.
Yeah, that seed of access to care really was planted through the work that was done at the state level with the partnership with our South Carolina Hospital Association and the Duke Endowment. There was an opportunity for us to bring a grant focused on access to care to our region. And so I was fortunate enough to be a part of that work since 2009. And we profiled our community to see if we were ready for an access to care program like Access Health Tri-County Network, which is still existent today. Before I moved to my role at Try to United Way as the Director of Health, Kevin and team on the call, I was the Director of Access Health Tri-County Network and built with that implementation of that program through the grant award that we got from the Duke Endowment with technical assistance from South Carolina Hospital Association. But in that profiling that we did back in 2009, I feel like that was our first attempt to collect some data, right, as a collective. So what you saw was all hospitals, all 4 hospital systems, our federally qualified health centers, St. James, St. T, and Federal Healthcare. Many of our, at that time, private physicians, as well as physician groups came to the table, our community-based organizations, all to come together around this collective around health navigation, which is now the buzzwords you might hear is, patient navigation, health navigation, community health worker, really bringing that model to our community through some grant funding. And since that time, we've been able to braid and blend funding and resources to keep that program operational and sustainable. And it's now been 13 years since that model has been in our Tri-County area. That navigation model is offered to all 4 health systems and working with all of what we call our primary care medical homes, which could be from our physician-owned practices, our medical groups of primary care, our federally qualified health centers, and our free clinic partners to make sure that those who are uninsured or underinsured in our Tri-County area get access to primary care providers with that warm handoff and referral that a navigator or health worker will make, but also focus on social determinant issues that patients or clients might have. And so if you find yourself that you have some food insecurity concerns, that navigator or health worker will help the individual apply for our public supports around our SNAP benefits. Or if they're having issues getting their medication, help with them apply for programming that would allow them to get their medications many times for free or at a discounted rate. So really focus on the social factors and being a part of the clinical care team, but also taking care of, we say 80% of someone's health is the, other factors, and only 20% is clinical care. Really, the community health workers and navigators help with some of that 80% to make sure that people stay healthy and well in our region. And we have that standing track record now of over 13 years and continue to grow.
We're so happy to have you in our community.
Yeah.
I'm so happy to be here. I'm born and raised here, grew up in Mount Pleasant. And so it's a personal reward for me to know that these programs are emerging, continuing to grow or improve and becoming evidence-based programs in our community that we can replicate.
Very good. Any other questions? Well, incredible work. Thank you so much. We're so fortunate to have you and so many organizations and stakeholders working together. Thank you for all that you do, organizing all this and putting this together to make our community healthier. And I meant to mention this at the beginning when I introduced you, but I did want to congratulate you. The Business Journal Diversity Leadership Award was announced on March 23rd, and Ms. Linyard Gary received that award, and that's excellent, very, very well deserved. And congratulations, and thank you for all that you do.
All right. Thank you. And thank you guys again for allowing me to share with you today. Look forward to coming back soon.
All right. Thank you so much.
All right. Bye-bye.
All right. The next item on our agenda is our community health update, and I'll call on Dr. Katie Richardson.
Thank you. My apologies. I'm on a different computer this morning and don't have access to my camera, but I do have a few things to share. The first of which is that it is National Public Health Week this week. And we have lunchtime talks each day to highlight the theme of the day. These are national themes. They start off with community. Tuesday was violence prevention. Today, reproductive and sexual health. Tomorrow, mental health. Friday, rural health. Saturday, accessibility, and Sunday, nutrition and food. So Paul sent out the webinars for yesterday and today, and I will share with him the information for the coming ones. Also, MUSC, the Department of Public Health there, is hosting events throughout the week, and on Friday, at their Harper Student Health Center, they will actually have their HPV or human papillomavirus mobile health clinic for anyone interested in going to tour that and hearing more about that as a wonderful opportunity to bring vaccination and screening out to those in need of it in the public. So National Public Health Week, and thank you all for what you do to continue to promote public health in our community. A few words about COVID. One is that just yesterday, the FDA said that they do plan to allow a second updated COVID booster for those ages 65 and over, as well as those who are immunocompromised. This is not a recommendation that those groups receive that second booster, but it is going to be an option for that group. The federal government does have a lot of that vaccine still left, and there is evidence that immunity does decrease, particularly for those vulnerable populations. The COVID deaths we continue to see are mostly in those two populations. In addition, the plan is to reformulate the vaccine in the late summer or early fall in order for all to have access to a yearly booster around the same time as the flu vaccine in the fall. But this will be a second booster of the one recommended in the fall, just for those two groups. Thankfully, we are seeing low community levels of COVID across the state. But when we look at the transmission levels, and that's what we use to provide recommendations around in clinical settings, we still see substantial transmission levels in the Charleston area. So that is an area where we say consider masking when in clinical settings. And of course, all are welcome to mask at any time to protect their health. Moving on to flu, we continue to see lower levels, regional activity. We had thought because of the early spike this year, we may see a second spike. That is still possible. We have seen flu activity increase as late as May, but with every week that we're not seeing that, it gets less likely, for which we are very grateful. That being said, flu vaccines are still recommended if you've not received one at this time. A few things going on with DHEC. We just announced this week that the QR codes will be added to our current restaurant grade stickers so that those visiting food establishments will be able to use that QR code to immediately link to a database that not only will you see what their food grade is currently, that's the A, B, or C on the sticker, but you'll also be able to look at historical data if interested in that. It's not yet available, but it will be available in the coming months, and you'll see it on those stickers. And then finally, nationally, two things. Naloxone, the FDA has decided should be available over the counter. That is because of continued increases in opioid overdoses. How that when exactly that will happen and how that will affect our ability to sort of have it at DHEC and DEODIS. I hope it will not, but a lot of that sort of remains to be seen. At this moment, DHEC and DEODIS continue to have free of charge naloxone for anyone in the public that wants to walk in any of those facilities and pick that up. And then finally, today, the EPA announced that nearly $74 million will be coming to South Carolina to improve our drinking water infrastructure. And that's nationwide, but that's what South Carolina is going to get. And I think that we have we certainly have needs to ensure that the drinking water is as safe as possible. So so we look forward to that money coming into South Carolina and hope to see improvements that it brings. So those are my updates, and I'm happy to take any questions. Thanks.
Great. Thank you. Any questions for Dr. Richardson? Paul?
You know, I'm going to ask a question. COVID, now that we are in this area, do we still need to test? If we've been around somebody, do we still need to test after 5 days and that 10-day isolation? Or are we just now treating it basically like the flu, where we remind people not to come to work if they're sick? What is the recommendations out there?
We do still continue to recommend testing for those who are symptomatic. And I certainly continue to hear of people that I know that are positive for COVID, and I suspect many of you do as well. And we do recommend, we don't recommend the 10 days of isolation, but we do recommend 5 days followed by masking for that 10 days. And then certainly if symptoms worsen again, testing again is recommended for possible rebound, and then again isolation and masking. So it is still contagious. What we see though is that those with the most severe consequences increasingly, this has always been the case, but I think it continues to be even more so the case that that those most affected are those who are 65 and over, and those who are immunocompromised. I will mention that the federal government does plan to end the COVID-19 public health emergency on May the 11th. And so we are getting sort of weekly updates on what that might change and what won't change. We do feel like testing will still be available, although it may come more through your insurance company paying for it rather than sort of the free supplies, but DHEC still has lots of free tests. So feel free to come into any health department and pick those up if you are in need. It will change some of the transmission levels that I was just talking about that help to inform clinical setting guidance. Those will not be able to be calculated in the same way because we will not get reports of negative COVID tests anymore. And that's important as part of the denominator for percent positivity. And so CDC is thinking about how to address healthcare guidance without those transmission levels. We will still get hospitalization data around those hospitalized with COVID-19, but that frequency may be reduced. So more to come on exactly what that will mean. And we believe that the vaccines obviously will continue to be available. But what I would say is please get your COVID test from DHEC if you need any. And if you haven't gotten your booster already, your first one, we're certainly recommending that. And then for those in the high risk groups, look for information soon around the FDA recommending that that second booster.
Very good. I see Joey Current has his hand raised. Joey, it's hard to hear you. I don't know if you have a way to turn up your sound, but for your mic. Joey, it's still very hard to hear. I'll try to turn up. Well, while we're waiting to see if we can hear Joey, does anyone else have any questions?
Katie, I gotta go back and ask that question. Are we still needing to do close contact calls if somebody's been around somebody who's had it? Or is that just up to the people to talk to each other to let them know that they've been around somebody that they were around them that could have spread it.
Yeah, I think that's up to organizations to make that decision for themselves. We certainly do recommend those who are positive to let their close contacts know. I think many organizations are no longer sort of having staff do that close contact investigation, but certainly just making sure that the person who is positive, knows about the guidance for isolating, and then for masking, and then recommendation that they let their close contacts know so they can watch for symptoms and test. But certainly any organization that wants to do contact tracing, we're not going to discourage that.
All right. Any other questions for Dr. Richardson? Well, thank you very much. Appreciate your community health update as always, and thank you for all that you do for our community. Thank you. So we'll move into our community updates, our roundtable discussion, and I'll check first with Jennifer Brush, Department of Mental Health.
Well, thank you, and good morning, everyone. Joey did put something in the chat saying he's in transit, so he's going to yield his time. That's why we couldn't hear him.
Very good.
But yeah, I have a couple updates. Last week, Thursday, I can't remember what day, it was Mental Health Advocacy Day up at the State House. So all the mental health centers went up there to raise awareness and talk to our legislators. We had, I think, 11 of our 16 RVs up there, which was pretty neat. We've never brought them all together before. And for Renee, speaking to access to care. The reason we have RVs in all of our mental health centers is to go out in the rural areas and provide mental health treatment. So they're all called Highway to Hope, which our patients named here in Charleston. So they kind of copied the name across all the centers, but that was a kind of a neat thing to do. And a lot of our patients went with us. So that was good. I see Paul looks like the bridge run behind him, and we had our same 10 patients from Dorchester Clinic go to the bridge run again. We had a bunch of really neat pictures. They're so proud. I think they've done it for probably 8 years now, done the bridge run. And so we're really proud of them for that. 988 is still moving along here. We have 6 staff hired and we're in the process of training. So as the second 988 call center for South Carolina, we're hoping to be open here sooner than later, maybe in a month or so. Not in our actual location, but we're going to wing it and do it from here a little bit until we get moved into our building across the street. But again, our goal is to be able to answer all 988 calls from South Carolina in South Carolina. So I'll keep you posted on that. Again, our crisis stabilization unit at the Social Services Hub is open. And if anybody needs information about how to get in there, you just call our center, and mobile crisis or intake department can help get people in there. It is voluntary for folks 18 and older. We are starting to hire more school mental health clinicians, which is good, and some other clinicians. So things are looking up staff-wise as far as that goes. In May, I'm going to continue to send y'all information about our Art of Discovery exhibit at Picolis Spoleto at the Circular Church downtown. It'll be a 2-week art exhibit for kids across the whole school district in Charleston and Dorchester, with a mental health focus, obviously. Conference is coming up in July, and I'll keep sending Paul information about that. Great speakers, great 2.5 day or 2-day and 1 night event again this year. And then lastly, there's still lots of talk. There's a couple of bills up at the State House, which we were up talking about last week also, about DHEC. You never know, Katie and I could end up in the same agency, but by the time this is all over, we're not sure. There's 2 different versions of it, of splitting DHEC into 2 agencies and us being part of it and us maybe not being part of it. So time will tell on that one. So that's my update here, and happy to have good spring weather, and hopefully things are getting some back to new normal, right?
Great. Thank you very much. Appreciate everything there. Maggie Dangerfield, I know you have about 2.5 days and you get a very well-deserved spring break for all the Charleston County school employees. So I thought I would call on you.
Sure. Thank you so much, Councilman Shealy. We are sliding into spring break next week, so that's exciting. Little reprieve for everybody as we move into this last quarter of the year here soon. This week is school choice acceptance week, and so those decisions are being released this week. So for those who have applied, they should be seeing those at some point in the next couple of days if they haven't already. Additionally, we are still running our COVID and flu clinics, which are free to our staff and students and their household family members. The schedule is available on our website. It's very similar to the past months where we have multiple sites a day across the district, starting either at 10 a.m. or noon, going through 6 p.m. or 7 p.m. And then on the weekends, having a site on Saturday and Sundays, one single site. We aren't doing testing though over spring break. So right now on our website, the schedule goes through the 14th of April, and we'll be updating that with the schedule for the rest of April and early May here shortly. Some other fun celebrations this week. It is the National Association for the Education of Young Children's Week of the Young Child. So several of our schools are recognizing that and engaging with our young students in reading and other fun activities. And it's also National Assistant Principal Week. So if you see your child's assistant principal, thank them for all that they do. It's also School Library Month. So there's ongoing celebrations throughout the district related to that as well. And that's really what we have going on at the moment. I can't believe April is, before we know it, it'll be over and we'll be swinging into May with graduations and planning for 2023, 2024.
Very good. Well, thank you for all that you do with our young people in Charleston County. Thank you so much. So, Kimbo Yee, do you have anything from the Citadel?
Yeah, I know everyone's still coming off the high of this past weekend's Cooper River Bridge Run, and they're looking forward to the next 10K to do. So we will be actually having one on Sundays, April 23rd on campus. It's called the Citadel Bulldog Challenge. So it's another 10K. This is done in teams of either 2 or 4, and it's just another 10K. Just you'll come across various obstacles like the U.S. Marine Corps obstacle course, fireman carrying, stadium steps, sled carriers, all the fun stuff. So I'll put the registration link in the chat. But yeah, if anyone's interested in doing another 10K, there's one to do. So
all right, very good. Thank you for mentioning that. I see Quentin Tompkins has come on. Quentin, any update from MUSC there where you are?
Yeah, sure. A lot of things have been mentioned already today. We just held our conversations on race and health equity, as Renee mentioned, but Joey is not able to talk. So Joey and I actually presented all the great work that we've been able to do with our partnership here to United Way worldwide. And these are United Ways from across the country. And we were able to present all the work that Healthy Tri-County has done. And I spoke specifically to the conversations on race and health equity. So just wanted to point out the fact that the work that we're doing here in the Charleston area is a shining example. As Renee mentioned, our health needs assessment was an example, or being looked at closely as a shining example of how we could do it throughout the state. But with the conversation we had the other day, Joey and I, we actually presented to people throughout the country within United Ways to show them how it can be done and how the community can come together. We also just recently had our 4th annual Senior Expo out at the Convention Center. So I'm not sure, I think many of you may have participated in that. Jennifer, just wanted to say great showing at the State House last week. The other week I was up there as I spend most of my time this time of year up there at the State House, but great showing from your agencies across the state. So.
Very good. Awesome. Great work. Thank you so much. Appreciate you sharing that. Anything else? Anyone else that I left out on community updates? Anyone else? Paul?
Well, I'll just share because this was a running joke between the mayors, but when we were having the press luncheon for the bridge run, the traffic was backed up on the Ravenel Bridge behind us, and Mayor Haney said people were waiting to get into Mount Pleasant. So I had to put this picture up, hoping the mayor was going to be on to give him an opportunity to say back that, yes, they rode over to Mount Pleasant, but on the race day, led by Councilmember Seekings, they all ran back to Charleston. So I just wanted to pass. That's why my picture was back here today.
Very good. All right. Thank you, Paul. And I do see that Councilman Seekings is on here. Thank you for joining us today. And I appreciate all of you that have joined and spent your time. I know how valuable your time is, but it's very, very valuable to the city of Charleston as well. So thank you for being on. And do we have anything else that should come before this committee? If not, we're going to stand adjourned. Happy Easter and happy Passover, and hope you have a great end of your week and weekend. Thank you so much.
Bye, everyone.
Thanks, everyone.